afternoon and welcome back here at Global TV, ESCMID Global TV. My name is Justyna Kowalska and I'm your host here at the ESCMID Global TV studio, from which we are broadcasting to you live every hour on the hour here from the Via Gran Via in Barcelona, Spain. I'm very pleased that I get to introduce to you my next guest, who is Justyna Kowalska. She is a professor of infectious diseases working at the Hospital for Infectious Diseases in Warsaw, Poland. And recently, during the pre-ECMID days on the 28th of March, she participated in a science track organized by the ESCI, the ESCMID study group on infections in the elderly, in which she gave a talk called "You're Never Too Old for a Sexually Transmitted Disease."
Yeah.
Well, that triggered us, and then we want to hear more about this, Justyna. But first, warm welcome for you here in our TV studio. Very happy that you had the time and effort to join us.
Well, thank you for having me, and I'm very happy that this topic gathered so much attention from media.
Yeah.
I think it's a very important topic, and it's not only regarding sexually transmitted infections, but also to raise awareness that elder people are also enjoying sexual activity and sexual life. Therefore, we as physicians, also researchers, people from diagnostics should be aware of that and adapt to this.
That's probably why it gained so much attention, that a lot of people are just not aware of sexuality in elderly people.
And I think it's very important to underline that the life expectancy is increasing, and it's on average in the world, it's increased up to 75 years. For high-income countries like UK, Japan, but also Korea, it's around 80, even 80. And for lower-income countries, South Africa, it's 65. So it is still a long life to have. And also, people are increasingly getting healthier, and they enjoy life more. And we cannot judge that a 65-year-old would not have a capacity to enjoy life. 65 is the age range that for most societies is a senior citizen, right? So we consider that this is post-work, post-life, but no. For many people, that's when life starts.
Because what age group are we talking about in the meeting that you were in? Because we're calling it sexually transmitted diseases in older people, but when are we older?
I think that...
Is it 40 up or 60 up?
Exactly. We try not to set the line, because...
I can imagine why.
Yeah, some 30-year-olds cannot enjoy life the way that 80-year-olds can.
Exactly.
So it's all about capacity and trying to dissolve this line, so people would not approach patients with the perspective of age, but rather habits, as I said, life and health capacities. But yes, as you mentioned, we are experiencing a rise in sexually transmitted infections in general, and this also adapts in different populations across the globe. It also is relevant for older people. So, for example, the data from US CDC, Center for Disease Control and Prevention, are quite well known and well collected, and we know that there is a 5% increase in sexually transmitted infections.
In adults or in elderly?
Diagnosed in 45 to 64 years old.
Wow.
So there is an increase, and to some extent maybe because there is an increasing awareness and there is increase in diagnostics, but I also think that the other factor, being more healthy, more enjoying life more, and the change in a lifestyle also adheres. There is a very
and is there something to say about the regions where this was measured, this increase? Is this a global number, or is it...
No, that's for, as I said, for US.
Oh,
but
okay.
I think there is not too many studies in age over 60. And it should be. So it's also a call to researchers that we focus also on including older age into our research. There is an ongoing, very interesting study that is performed in Sweden.
Yeah.
And it observes, it is a survey study, it observes sexual behaviors, self-reported sexual behaviors since 2001, and recently in 2021 they published showing that, for me it was really something new to learn, that 46% of their cohort have been, 46% of those over 60 were sexually active, and 10% of
How
those...
much? 46%?
46%. So
almost half. Yeah.
Yeah, so it's almost half. So I don't know if it's a lot or a little.
Yeah.
I think we will be seeing more. But very interesting that among those 90 years and older, 10% were still sexually active.
Wow. Yeah. But just maybe a critical question, because these are self-reported numbers or self-reports on sexuality. What do we know about these? Because I can imagine that's the only way to get info or data on sexuality and sexual activity. How sure are we if this is a true representation?
I think sexuology is a very interesting discipline, and what they say is that there is no one norm. So sexual activity that satisfies someone can be very different.
Also,
for some people it's one partner lifetime, for others it's changing partners, and as long as this is informed consent of two adults, it's just the way people
Absolutely.
live. No, we will not have an observational or randomized data, and it always be a self-reported, also in terms of satisfaction. And very interesting is that men tend to report more being not satisfied with their sexual activity than women. And again, you don't know how much in it is medical factors and how much is social factors. But it is interesting to know it, so we can approach better our patients. And as you said, self-reported. But there has been some nice area of research in non-pharmacological approaches to educate about sex, especially among elderly. And a very important part is peer-to-peer. So we would say gossiping, right? So one to another, and that's a very well, it works very well in this group. Also that people older would not be taught by younger. There is a lot of, being ashamed or shy, and generation gaps.
Absolutely.
So peer-to-peer
so many factors that influence this, these outcomes.
Exactly. But anyway, we need to test as well, not only talk about, but the first step is to talk. That's why it's infectious disease talk, and I'm speaking about, rather the behavior factors. But it's important to start discussion, to understand that sexual health is a part of health, and just ask for it. And sometimes, in my practice, you just open a question whether you are satisfied with your sexual health, and people say, yes, yes. And after a couple of the visits, they would say, you've asked me once.
Yeah,
and
so you open it up by just putting the question out there.
So it's very important. And another factor is that we have experienced a major development in sexuality dysfunction treatment, which is an erectile dysfunction drugs being introduced in market in 60s, like sildenafil, now it's tadalafil, and a couple of others. And that really helps men, mostly men, although we know there are some a few, but still good research that show that women can also benefit from a blue pill. But this opens, possibilities and abilities for men. Another important part is widowhood.
Sorry?
Widowhood. So widowhood, when you lose your spouse.
Oh, yeah.
And
sorry.
Yes, yes. It's a funny word, but so the widowhood affects women more. but men are more likely to open to new relations. And one of the studies showed, it's a Medicare study. So Medicare is this huge insurance company in US, and they have been observing over 420,000 couples and how their life evolves, who becomes, who is losing spouse and becoming a widow, and how it affects many different activities, including sexual activities. And it was really interesting for me to learn that men are more likely to engage into new sexual relations in the first year of becoming a widow.
So the first year.
So
okay.
Very early, very early, and it gives us, these studies gives us important knowledge, because then you know that in a moment when you feel it's maybe not accurate to ask about sexuality because someone just lost his wife.
Yeah, it is
that's the
important
moment
to do
where
so.
actually maybe you should talk about it. And also, I mean, something that we laugh at, but it exists and it should be acknowledged, like sugar daddy. Something new, right? So older men, younger women, consent relations, that also is a factor.
Okay, so we need to be aware that older people
enjoy
have
life.
sexual intercourse or activities, sexual activities. I need to state that correctly. So we know that, and we also know that there's an increase also in this group of sexually transmitted diseases.
Yes.
Now, my question would be, is that how susceptible are elderly to STDs? Are they just as susceptible as younger people? Because there needs to be a sexual transmitted infection going around in the same circles before you can contract it.
So, I mean, a very interesting question, a completely new topic. Yes, we may say that older people might be less sexually active than younger people, so there is less exposure, but at the same time, they are more vulnerable because of biological factor, so especially menopause in women, that they experience vaginal dryness, and in men, if you have erectile dysfunction, then probably you are not able to wear condom for all the intercourse. It's more tricky, and there are many factors like this important. Another thing is cohabitation, so that older people start living together. And it's becoming more and more a custom of our times. And in these elderly houses, they just have new opportunities to meet people.
Oh, you're referring to nursing homes and such
Which I don't like the term nursing. Because
I felt
many of them don't really need a nurse.
No, exactly.
They enjoy being together.
But just to make sure we're on the same, okay, true. They meet a lot of new people. But do, I mean, like, for example, an infection like HIV, with HIV, certain groups are more at risk to contract HIV. Is that also applying for elderly, or is that also different?
Yes, in different ways. I think that HIV is not different from other sexually transmitted infections. But here, the dominating mode of transmission is men having sex with men, and it also applies to age. And this is a group of people who are usually taking a really good care of their health and being really physically active. So entering their elderhood with a bigger muscle mass, for example, is improving the quality of aging, and these factors also help that they enjoy more. So we see that the increase in infections we of course see among this group, and not only HIV but also syphilis, chlamydia, gonorrhea, and that's why it's important to ask about orientation and you know,
Yeah.
the behavioral things.
Yeah. So which STD is most prevalent in elderly and which one is most
Oh,
prevalent
that's
in
very,
younger people?
that's very
It differs
difficult.
per
I
country,
wish
of
to
course.
know that. Of
Yeah.
course, HIV is a rare disease in many
Yeah.
countries.
Yeah.
In African countries,
It's
in
more
like
common.
Ukraine, this is, we would say half-half. Women are at least half of the population, so it's different. Syphilis is it's always doing great. For some reasons, we are unable to stop the syphilis epidemic.
Yeah.
And I think we just should be aware of all of these infections.
Yeah.
There is another thing I would like to mention is that why we don't test for HIV, because while we do the screening for older people, we are no longer worrying about fertility, and also older people, they are not worrying about fertility issues, so the contraception, which unfortunately condom is still the most common way of contraception, or maybe fortunately, because that's how we all...
Yeah, that's how we also prevent STD. Yeah.
Yeah, but 60% of pregnancies in the world are not planned. So we can see that if we would start planning, we would be 60% less.
Yeah.
So this is something behavioral. Yes, but yeah, I believe that's it.
Yeah. So we are not too old to get a sexually transmitted
Never
disease,
too old.
and we really need to be aware of that. And if I can summarize you, you're also saying it's so important that every person working in clinical medicine in whatever field is really asking these questions and not differentiating on age or taking up your own beliefs that people of older age may not be or will not be, because even if they are widowed, then they may even increase their sexual activities pretty soon already.
Offering testing the same way as for other age groups. So don't exclude people from testing because of age.
Yeah.
This goes not with age, but with activities they have. So that's one thing. The other thing is maybe to be proactive. These people would not tell themselves, but being proactive usually helps a lot. And
don't assume. Don't assume.
Don't assume, yes,
assume.
absolutely.
No. Yeah. Always ask.
Yeah, and maybe also help people to enjoy sexual health.
Yeah.
It's very rare that we as physicians accept gynecologists, we consider ourselves to be able to help with menopause, for example, but topical estrogens can be prescribed by any doctor.
Yeah.
And we can also offer natural estrogens to women, which are now getting more attention and more evidence that they are really helping to decrease menopausal symptoms and help everybody to enjoy life better, because if women are calmer and happier, all the generations are.
Yeah, that is very true. I think that's an excellent wrap up. Thank you so much, Justyna, for taking your time to come here during your probably busy Congress also, and talking to us about this very important topic. And I hope that at least the viewers who are watching us are more aware of the fact that elderly are also sexually active and have every right to enjoy life, and that we as clinicians can help them to do so better. So thank you so much. And for our viewers, you can, I think you can watch on demand the talk Justyna gave on March 28th at 4:15 on the pre-ESCMID day. So look it up online. It's also in the Congress app now. Take a look for more information on this very important and relevant topic. We will be taking a short break here at ESCMID Global TV, but we will be back at 4 o'clock when we will be inviting one of this year's Congress's keynote lecturers, Dr. Sodiomon Sirima, he's from Burkina Faso, and he has already given his keynote lecture this morning. So you have to watch it on demand if you get get interested by the interview here at 4 o'clock. His talk is on the innovations in diagnosis, treatment, and prevention of malaria. So tune in here at ESCMID Global TV at 4 o'clock and join me in interviewing him and hearing his experiences with his keynote lecture. Thank you so much for watching. See you at 4.